Hello everyone. For laboratory number 4, we will discuss standard precautions and transmission-based precautions. What is standard precautions? Standard precautions are the minimum infection, prevention and control practices that must be used at all times for all patients in all situations. Standard precautions are the work practices required to achieve a basic level of infection prevention and control. The use of standard precaution aims to minimize and, where possible, eliminate the risk of transmission of infection, particularly those caused by blood-borne viruses. Standard precautions apply to all patients regardless of their diagnosis or presumed infection status. Standard precaution must be used in the handling of blood, all other body fluids or substances, regardless of whether they contain visible blood, non-intact skin, mucous membranes. Standard precaution consists of the following practices. First, hand hygiene. Hand hygiene is considered one of the most important infection control measures for reducing the spread of infection. Hand hygiene is a general term that refers to any action of hand cleansing, such as hand washing or hand rubbing. Hand washing, hands should be washed with soap, water when visible soiled and after using the toilet. Hand rubbing with an alcohol-based hand rub is the preferred method for hand cleansing in the healthcare setting when hands are not visibly soiled. Number 2. Personal protective equipment or PPE. PPE protects the healthcare worker from exposure to blood and body fluids or substance. PPE that complies with relevant Australian standard should be readily available and accessible in all health services. Gloves. Gloves used for healthcare activities are to be single-use only. ABHR should not be used on gloves to decontaminate them, nor should gloves be washed with soap and water and continue to be used. Wear gloves when there is a potential for contact with blood fluids or substances, mucous membranes, or non-intact skin. Change gloves between tasks and procedure on the same patient. Gloves should be removed immediately after a procedure and hand hygiene performed so as to avoid contaminating the environment. The use of gloves should not be considered an alternative to perform hand hygiene. Hand hygiene is required before putting on gloves and immediately after removal. Gowns and aprons. Wear an apron or gown to protect skin and prevent soiling of clothing during procedures and patient care activities that are likely to generate splashing or spray of blood, body fluids, secretions, or excretions, or cause soiling of clothing. Select gown or apron that is appropriate for the activities and the amount of fluid likely to be encountered. If an apron is used, staff should ensure they are bare below the elbows. Remove the used gowns as promptly as possible and roll it up carefully and discard appropriately. Perform hand hygiene immediately after removal. Mask, eye protections, face shields. Wear a mask and eye protection or a face shield to protect mucous membranes of the eyes, nose, and mouth during procedures. Patient care activities and cleansing procedures that are likely to generate splashes or spray of blood, body fluids, secretions of and excretions. Remove the mask by holding the ties into and dispose of the mask into a waste bin. Perform hand hygiene immediately after removal. Environmental control. Ensure that the health services has adequate procedures for the routine care, cleaning and disinfection of environmental surfaces, beds, bed rails, bedside equipment, and other frequently touched surfaces that are this procedure are being followed. Transmission-based precautions. Transmission-based precautions are used in additional to standard precautions when standard precaution alone may be insufficient to prevent transmission of infection. Transmission-based precautions are used for patients known or suspected to be infected or colonized with epidemiologically important or highly transmissible pathogens that can transmit or cause infections. Transmission-based precautions are not required for patients with blood-borne viruses such as HIV, hepatitis B virus, or hepatitis C virus. The type of transmission-based precautions applied is based upon the mode of transmission of the pathogen. For diseases that have multiple routes of transmission, more than one transmission-based precaution category is applied. Transmission-based precaution should be tailored to the particular agent involved and the mode of transmission. To minimize the exposure time of other people in office-based practices or hospital waiting rooms, people identified as at risk of transmitting droplet or airborne diseases should be attended to immediately and placed into appropriate transmission-based precaution to prevent further spread of disease. This is the end of laboratory 4. 감사합니다. 안녕.